Good afternoon. The assignment for this week, Module 6, is to review the complete project plan and defend the project plan with regards to the initiative which we currently have. So the project I have been working on, um, building all the artifacts during this the project management course, is related to an EMR application development project. I'll walk you through the several artifacts which we have built, as well as the summary of the project to defend why we would want to execute this project. Starting with the executive overview, the purpose of this project, or the reason why we are doing this project, is in the long-term care industry, which provides health care services to geriatric or population which is 65 years and older. There is a specific need for an electronic medical records platform in the facilities and the skilled nursing facilities or post-acute facilities. The idea is that this electronic medical record platform will capture patient clinical, demographic, insurance, and medication information, and it will also have a tightly integrated interface with the pharmacy dispensing platform. And the intent is that once this platform is built, we will have it also integrated with other platforms in the industry. The purpose is to, once this application is developed, it will make the skilled nursing, the nursing staff in the skilled nursing facilities and post-acute living facilities more productive, and it will eliminate paper inside the facilities, so that the information is electronically captured. The information which is actually intended to be captured is the demographic information, the clinical, payment, and insurance information of the patient. The product, once developed, will enable the facility staff to track medication administration for patients and retain information for state and federal audits as well. There are certain benefits for developing and implementing this application. It will increase the pharmacy revenue. Once this application is built, it is intended to be added to the sales portfolio for the company, and it will be ready to commercialize to and offered to the skilled nursing facilities, hence increasing the pharmacy revenue. It will also improve the skill facility productivity by electronically capturing the patient information and transmitting it to the pharmacy and physicians, hence eliminating the need of paper faxes and follow-ups. The project is going to be built on a Microsoft platform, um, and it will involve collaboration with various functional groups inside the pharmacy domain, including pharmacy operations, business, billing operations, implementation teams, finance, IT, sales, and customer service. The requirements and the feature functionality for this application will be captured based on the focus group study, which will include several representatives of clients as well as pharmacy representatives. The high-level requirement for this initiative is to deliver an xEMR application product which has the capability to be accessible from customer location on the internet. This application is intended to capture demographic information with regards to name, social security, sex, and date of birth, clinical information like allergies, diagnosis, or clinical conditions, insurance information related to who the primary payer would be, who the secondary payer would be. It will also capture the physician information and clinical information for the physician, as well as the most important medication information for the resident, which drug is prescribed to them, what are the directions for the drug, the dosage, and the specific, if there is any specific NDC which has to be captured. The other high-level requirement is that it will have the capability to bill appropriate insurance payers and retain those records for 7 years for audit. The other functionality would be to have the capability to interface with pharmacy dispensing platforms and transmitting medication and patient information to the pharmacy. And the most important functionality would be that the application needs to be scalable. If it has to be included in the sales portfolio so that it could be implemented across multiple facilities. Once we have the requirements, we wanted to make sure that the scope is well defined and the deliverables are approved. Again, the scope is of this application is to cater the skilled nursing facilities which will satisfy the clinical and medication administration needs of a patient. As part of this project, there are four specific deliverables which are being targeted. One is the development of this platform and deployment of this platform to the skilled nursing facilities for utilization. Two, it needs to be a hosted application on company's infrastructure. Three, operational interface between the xEMR platform and the pharmacy dispensing platform. Four, as part of the deliverable, there will be training documentation which will be utilized to bring a nursing facility on board. There are certain risks identified in executing this project. Loss of revenue. If this product is developed but the specs are not to the intended requirements for the facility, there is a possibility for the customer exiting the contract, and hence there is a loss of revenue. Conflicting priorities. If there are other initiatives, strategic or tactical, which are priority for the organization, this project might take a backseat. And if this product is shelved, then there is whatever development activities has been completed, those will be written off. Scalability risk. If this product is not tested with regards to volume, there is a risk that it will have significant performance issues, uh, and hence it will decrease the user experience on this platform. So those are the very high level risks which are identified for this project. The completion criteria. I mean, for us to make sure that before we close the project, to understand that this is delivered to the requirement, we need to make sure that the product is successfully deployed to the facility location. Product offering is included in the sales portfolio so that any new sales or any new opportunity, this application is being offered. We have a robust pricing and commercialization agreements for this product. The reconciliation of the actual spend versus budget, and then lessons learned exercise completed to make sure that the best practices and opportunities are being implemented on the projects which follow this. The final goals for this project is to increase the revenue by 18% annually by commercializing this product, and then improving the productivity by 25%. The assumptions are that the team being used will be internal development team, business subject matter experts will be available for consulting, and technical resources are going to be available during the course of this project. Training and implementation services will be provided to the customer, and commercialization agreements for these applications will be in place. There are certain constraints which are highlighted here, like resource constraints with regards to resource availability for the project, technical constraints with regards to design approvals from all disciplines in IT, being approved at a set time and not getting delayed. Partner constraints with regards to business partner availability during the product launch and training phase. As part of this initiative, we built a cost-benefit analysis to prove out that there is definitely an intended benefit with regards to executing this initiative. As you can clearly see, that the projected cost, which is taken into account the effort, the labor effort to build this application, as well as the non-labor cost related to infrastructure, training, logistics, travel, and contingency. The total cost projected at this time is around 1.25 million. But if you look at the benefits, and looking over 5-year period, there is a significant benefit with regards to new sales opportunities, as well as soft benefits when we increase the productivity at the pharmacy, as well as a skilled nursing facility. And I mean, if you see the CBA, it's clear that the break even is going to occur somewhere for around the 4th year. So there's definitely a benefit to building this product. Most of the build cost is capitalized and hence would be depreciated as part of the software development effort. Moving on, there is a risk register which has been captured with regards to this initiative, and the risk register we captured is tied to loss of revenue risk, conflicting priorities, scalability risk, impact of COVID, and procurement delays. We identified the probability and the impact for these risks, and then appropriate mitigation summary is captured, and the response for those mitigation strategies, and finally the status of those risks. And the intention is that the risk register would be kept updated throughout the course of this project, of this initiative. The next is the budget. The budget is taken into consideration both the labor and the non-labor breakdown, and the template will facilitate the approval cycle with all the senior leadership management in the company. As part of the appendix, we have included the breakdown of the work breakdown structure, where all the tasks are identified, and the description was for those tasks with regards to milestones and the resources identified. So these are the work breakdown structure. And then we built out a network diagram, and also identifying the critical path the project is going to take during the execution. Finally, there is a Gantt chart with regards to graphical view of the project plan listed here. The intended discussion here is that based on the review of this project plan, the request is to approve this project plan to move forward with executing and building this xEMR application. Thank you.